So as a young nurse, I worked in the Milwaukee VA for about 25 years prior to moving to the regional, we call them VISN. I was the Chief Quality Management Officer and Chief Nursing Officer. So I was aware of Tomah's issues in a high-level way. But about 2012, really started to be concerned about increase in pharmacy complaints here at Tomah. And that's when, some of those very important investigations with the IG and those types of things came up. The culture was toxic. The leadership was gone. There were concerns about the practices, the medication practices, especially with the opioids and benzodiazepines. There were concerns about that. There were concerns about stabilizing the staffing because we had lost a lot of employees, walked out because they weren't even sure the Tomah VA would survive. There was so much media attention, there was so much, IG, there was so many groups that were in here looking at what was happening at Tomah that we were trying to make sure that foundationally they were staying, that they were still providing quality care. This wasn't the type of position where you could just act until we could find somebody new, so kind of just fill in and keep things going. The change had to happen. So I wanted to rebuild, but rebuild the right way. I've been passionate about serving veterans, and I believe in the VA system wholeheartedly. I had 6 brothers, several have passed away, but I have 6 brothers that were in the military and my father, so I have wanted to serve and came in right out of nursing school into the VA for that purpose. So it's near and dear to me, and I think we have a mission that it would be difficult for others to serve. We looked at all the results of the investigations. We looked at defining a vision and a mission, because if you don't have a vision and a mission for what you are, you cannot resource correctly. This is what we're going to do. This is what we're going to serve because this is what's needed. We were not going to be an emergency room department that did transplant surgeries. We were not going to be an acute care center. We determined, number one, we were really going to focus on being very good at mental health. That is a gap in the community in terms of the entire continuum of mental health. So from very acute, like our locked mental health ward, to very intensive outpatient, treating substance abuse, military sexual trauma. So not too long ago, the President put out the executive order saying that we could see other than honorably discharged veterans, for a period of time. What we're hoping is we can get them through some of our whole health modalities and bring them in where they would be working with a whole health coach on some of their issues, and then that coach could help them get into the pathways that they need to be in. One of those pathways is our Pain University, which is pretty famous. In May of 2016, we launched that, and that has been a huge support for our decrease in opioids and our awareness of veterans, understanding, pain and what pain does to them and the dynamics of that. We also did a lot of healing because people were traumatized. So I had to do a lot of over 75 listening sessions, getting out, doing town halls, telling the staff it's going to be okay, we're going to do this, we're going to stay on track. And growing up in the VA system, I know that we are of a political nature. We are a federal hospital. From whatever the previous issues were, we now have had all of these groups back in showing very good results. So that's wonderful. I'd like to say that our data can speak for itself. Our veterans can speak for themselves. Are we perfect? No, we're not perfect. We're striving for excellence. Keep focused on the mission. We're all here for a mission. That's what drives us. That's why we take these risks. That's why we stay even when we're under fire like this, because we believe in the system. The minute that we're not of value or we don't have a mission to serve is the time we should give it up. And my theory is, if we can serve the veteran and do a good job, let's do it. If we can't, we shouldn't.